Hi everyone, it's Mr. Crosson and these are my two, oh god, these are my two best MAs.
Oh.
We have Riona, say hi Riona.
Hi.
And Addie.
Hello.
Hi Addie, sorry I don't know how to use this. Okay, so today I'm going to show you guys how to do common venipuncture techniques and injections, except for glute, sorry. But we will be doing the other ones, so I'm going to be the cameraman. I'm at charging my girls at the cost of me buying them lunch to help demonstrate for you, okay? So let me turn the camera around so that we can show you these things, and then I will narrate and instruct you. Hold on one sec. Okay.
Introduction. Okay. Hello, my name is Riona. I'm going to be a medical assistant today.
Perfect.
The doctor has ordered me to do a blood draw today. Have you ever had this done before?
No.
No? Okay, you're going to feel a tight pinch of the needle and like a little squeeze of the tourniquet. Do you faint at the sight of blood or needles?
No.
Are you allergic to any latex, bandages, adhesives, or tapes?
No.
And are you fasting?
Yes.
Verify name and date of birth.
I forgot that part. Sorry. Okay, and then can you verify your full name and date of birth, please?
Yes. It's Addie, and then Urbina, and then 1139.
Did you ask, have you ever had your blood taken before?
Yeah, I did.
Were there any complications? Did you faint?
No.
Okay, great. So now what she's doing is, Riona, would you take that off again?
Okay.
So the first thing we're going to do is, after the patient offers their hand, or arm, excuse me, is that we're going to examine the antecubital space for viable veins that we can either visualize and or palpate. Okay, and you can do that just by sight, but it's usually best to tie the tourniquet. And the way to tie the tourniquet is to tie it as tight as possible. You want, wait, back up again.
Okay.
You want to hold your thumbs nearly together. Hold your thumbs nearly together.
Okay.
You want to hold your thumbs. You want to hold your thumbs nearly together. No, before you pull on it, under the arm.
Oh.
You want to, yes.
Like this.
Then you can pull
Okay.
it nice and tight around the arm. And the what you want to do now is, sorry, I almost hit her in the head. You're gonna want to tuck one of the straps.
Oh boy.
Right
I
under,
don't tie it.
right under, over, and down. See how it's tucked in there? That way she can pull on it easily to snap it loose. Yes, exactly right. Just like that. When you're done, that way you don't have to fiddle with it, because you don't really want to do that when you've got a needle in a patient's arm. So she's going to retie it again. Again, nice and tight. I know your students like to ask if it's too tight. And when you're just starting out, it's fine. When you become a more experienced at this, you don't really need to ask. Also, a lot of patients will report that it is too tight because they're whiners. Don't worry about it. Damn it. Hang on.
Name Addie.
Oh, I'm recording again. Okay, so sorry about that. So now we're going to retie the tourniquet. Here.
Oh gosh, I'm sorry. Hold on.
Sorry, this is far from a professional video, but I thought it would work better than some boring YouTube video. So she's gonna tie it with the tuck method. With the tuck method. With the tuck. Okay.
The tuck. Okay.
Good. Now
She's
she's gonna identify a vein that it will be good for puncture by palpation. I would use this finger or this finger.
Huh?
I would not use the pointer finger because it can be callous and difficult. Although it depends on the person. You can use that one. It can be also sensitive.
I feel it here, and it goes.
Do you see it or you just feel it?
I can see it and I can feel it. It's like bouncing right here, and it goes.
And you get like a
this
little
direction.
bouncy resistance. It feels different from the surrounding skin. And usually that's what you're feeling. If an artery or tendons tend to be much deeper in the antecubital space and are unlikely to palpate those unless the patient is really, really thin. Okay, good. So she's remembering where it is. She's going to swab. Do you see how she just swabs 3 or 4 times in the circle? That's what we're looking for there. Not over swabbing. I like that she's swabbing after she has put on the tourniquet instead of before. I know there are instructions that say to do that. I understand that, but I prefer it this way because it reduces the chance of accidentally contaminating. She has all of her supplies ready for a venipuncture. That include a Vacutainer needle. That's the 2-sided needle you see here. The ones we have in lab are green capped. It's the same thing. I think it's just this one is a 21 instead of 22 gauge.
This is 22, actually.
Oh, 22 instead of 20. Okay, very good. The longer end is still capped. That's the actually what punctures the vein. Then the other side is a needle under a I think it's rubber, sterile rubber sheath. And that becomes exposed when it slides into a tube, and that is, of course, screwed into a tube collector. Okay. She also has what? A tube. 2 tubes. That's a serum separator tube and a lavender top tube.
This is supposed to be my cotton ball.
Gauze and or cotton is good. And of course, alcohol pads. And she's wearing gloves. Of course she is. And we're wearing masks.
And masks.
Because of course we are. Okay, now here we go. Arm's getting a little red because I was talking. Sorry about that.
That's okay.
So here's the thing. She's going to line it up. She's anchoring.
I'm gonna put my arm
She's
in.
anchoring herself to the forearm with her fingers. Do you see that? That way she can have a steady puncture that remains in place. And she's got her thumb even. You can even have it slightly forward from her pointer finger. That ensures the needle stays in place. If you tense up your hand, it keeps the needle in place instead of popping out. And we see Addie has formed a bridge to hyperextend the antecubital space. It also makes it easier to puncture. Okay, go ahead. Thank you.
You said okay. Are you okay?
The needle goes in nice and smooth, not too slow. Doesn't have to be really fast, but confident. You want a confident poke. And you see how she's anchoring the back of it where it flares on the tube collector. You see there with her fingers. That way she's able to push the tube in without altering the position of the needle. And blood starts to flow.
And I can take it.
Yeah. You pop the tourniquet. See, by just pulling on that one part that she tucked under, because the tourniquet goes up first. Then you remove the tube. See how she's using her fingers as leverage to do that.
You okay?
Good.
Yes.
She's not inverting that tube because it's a serum collector tube you don't need to do that with. And then, of course, the last thing that comes out is the needle. Then she immediately places gauze over it. And then what do you say to her?
Can you apply pressure, please?
So you allow the patient to apply pressure at that point so that you can dispose of the needle as soon as possible in the sharps container. In our office, thank you, our sharps containers on the wall, most medical offices have these smaller sharp containers that are wall mounted, but not all of them do. Okay. And then we've got blood.
We got blood!
We got blood, and it's successful. See, I told you you could do it. Okay, that is normal Vacutainer. And then we're going to make sure that she isn't feeling dizzy or anything like that. Give her a minute. Sometimes patients, it will be several minutes after having their blood drawn that they'll actually temporarily decompensate and lose consciousness. So it's a good idea to give them a few minutes in office, especially if they've been sitting, because sometimes they get a kind of a vasovagal reaction when they stand up. So you want to make sure they stand up and are able to walk around, walk to check out, and so forth just fine without there being any complications. Okay? Very good.